Indian River Connections brings you the first source you can watch for truth on board decisions in Indian River County. The Board Report, where taxpayers and policymakers intersect. Be sure to subscribe on your favorite platform to get notified when we go live on Fridays at 7 p.m. Visit IndianRiverConnections.com for more. Sponsored by Gus Curran's House of Champions.
Hello, everyone. Welcome to the Board Report brought to you by Indian River Connections. I'm Joann Binford, joined by John Karapi.
Hey, Joann. How you doing?
How you doing, John?
Good. Looks like we have a powerful lineup tonight in the green room. I'm excited.
Yeah, we do. Today, we're diving into our local hospital district with Paul Westcott, trustee for Seat 5. And
Nice.
John, who's our second guest?
Looks like we got Sheila Matthews from Shattering the Narrative and AbleChild, which is exciting because Sheila's all over with on Bannon and all kinds of different shows, and we're privileged to have her come on our show when she has the time. I'm excited.
Yeah, she's been doing a lot of work and traveling. She's just been so busy. So we're really fortunate to have her with us today. And you know, it's been a few episodes since we discussed the $4 million property intended for a women's sober home, and it raised a lot of questions about the budget, inspection reports, facility improvements, custodians, and annual operating expenses, and so much more. And I know that I put a call into Frank Isiley, the hospital district executive director, who's, despite 3 attempts to call him regarding my inquiry, he's not returned my calls. And the hospital district trustees are currently in the budgeting session. So this is going to be really good time for Paul Westcott, who's joining us, and he'll be able to discuss topics that are compliant with the sunshine laws, because we know they have to be careful when they are speaking about these subjects.
No, 100%. And then, again, like we always say, follow the money. So we have to, where taxpayers and policymakers intersect. That's why the board report was created for Indian River Connections and brought to you by Gus Curran's House of Champions. We wouldn't be able to do it without Gus and his support and 100% backing of our show and what we do and what our mission is.
Absolutely. So let's segue into the Gus Curran's House of Champions and commercial, and we'll be back with Paul Westcott.
Tired of the same old workout? Come knock out your fitness goals at Gus Curran's House of Champions. Founded in 1996 right here in Vero Beach, Florida, our Hall of Fame trainers will push you to your limits and beyond. Whether you're a beginner or a pro, we have the perfect class for you, including the one-of-a-kind Rock Steady Parkinson's training. So come join the fight and unleash the champion inside you. Give them a call, 772-713-1157, or go to gchouseofchampions.com.
Welcome back to the Board Report, everyone. I'm Joann Binford. I'm joined with Paul Westcott, Hospital District Trustee of Seat 5. Paul, thank you for joining us today.
Glad to be here.
Yeah, I'm really excited because, the hospital district has been a subject of discussion in our county. So, Paul, for those viewers that are joining us that are not familiar with the hospital district, what does the hospital district do and what is its purpose?
Sure. First of all, I'd like to do is let's talk a little bit about why we have a hospital district and the historical background for that. There was a season in our past where local rural hospitals were needed, but because of the demographic of a given community, did not have the ability to support what was needed. In other words, the revenue generated by the treatment that was being provided there wasn't sufficient. So special taxing districts were created, ours being one of them. And the idea was and has been that to the extent the local hospital needs to be supported by tax dollars, with a focus primarily or predominantly on indigent care, making sure that the indigent community population has the ability to have access to treatment, that those tax dollars are raised to underwrite the operations of the hospital. Now, there are a range of districts or types of districts that exist. And for instance, in Palm Beach County, their similar district actually provides medical care. In other words, they've got facilities that are operated directly by the district that is providing treatment in a range of ways. Then, say for instance, Just Parish Hospital up in Titusville, the district is formed exclusively, as I understand theirs, exclusively around the operation of the hospital. Ours is kind of in between. It was designed or created predominantly with the focus that the hospital was going to be the primary delivery source for the district. So the tax dollars were going through the hospital, supporting indigent care, underwriting that treatment, and so forth. Originally, the 7 elected trustees acted as a board of directors for the hospital. That is, they would be analogous to a board that has responsibility for the day-to-day oversight of the operations of the hospital. I don't remember the particular year, but along the way, a corporation was formed, Indian Memorial Hospital, Inc., and that board of 17 members assumed that responsibility and leased the physical plant of the hospital from the district. District collected tax dollars, paid money to this corporation in support of the indigent care that was providing there, in addition to providing some other things. And then in 2019, Cleveland Clinic leased the hospital facility. What was going on is there were some revenue issues that were going on with the hospital, with its operation, and the trustee. I was not on the trustee board at the time. The trustees at the time felt that it would be advantageous to bring someone in, an entity, to take over the operation of the hospital. Requests for bids were put out. It was a competitive process, and Cleveland Clinic was awarded that opportunity, and a lease was written between Indian Memorial Hospital, Inc. and Cleveland Clinic for them to operate the hospital. With that came an obligation on the part of the hospital to provide indigent care through the hospital. And then, so at that point, you can see a change in the role or direction to some degree of the district, and for the funding of agencies and entities in our community became more active, because there were the financial pressure of the indigent care through the hospital was alleviated, so the opportunity was viewed to meet the community's needs in other ways through other organizations. That was well under its way. I've been on the board now for 2.5 years. So that's a quick thumbnail sketch of districts, and ours in particular, and where we are.
So have the revenue issues been resolved?
Cleveland Clinic, you probably have seen reporting that they're having a lot of financial strain. They from what I've been hearing, COVID has played a role. The demographics of our community is being attributed as part of the difficulty as well. I believe 70% of our of the hospital treatment population is either Medicare, Medicaid, I believe, or indigent. That's a demographic that, from what we've been told, is making it really difficult for them to maintain a profitable margin. Dr. Rothman has reported to us that the trend is actually improving, that at some point we should see them moving into break-even profitable range, but right now that's not being achieved, but they're moving in that direction.
So to raise those revenues, they would have to be more competitive with private insurances, because Medicare and Medicaid doesn't really bring in a profit. And that would also include like have more people having babies at the hospital, but we don't even have a NICU in our hospital. So if
And
somebody
that's
had an emergency with their infant, they would have to fly them out of the hospital
that.
to Melbourne.
So the numbers on that have been discussed recently at some of our meetings, and roughly there are 1,200 babies, not necessarily delivered in our community, but born of our community.
So that
Of
means they're
the-
going elsewhere.
Of those, about 400 are going elsewhere. The big question that needs to be answered is why. The NIC unit is a topic of conversation as to whether or not that should be implemented. Let me pause for a second just to remind everybody, I'm one of 7 trustees.
Right.
So it's important. I want you guys to hear 2 things from me. One, I can't speak for the board.
Right.
I have a particular point of view on a number of topics, and frequently I find myself in the minority on some topics, and so I want to make sure that nobody takes away this discussion you and I have as being something that is more broadly applicable.
Well, it's more of a discussion to address the things that are going wrong, the topics and issues that could possibly be put at the table for discussion. Because
so from my perspective, it's an important question for us to have answered. And if we're finding that families are deciding, and I would suspect, given the dynamics, a number of those 400, if they are financially able to go someplace else out of the county, okay, keep in mind that most of your indigent arrangements are county driven. So for instance, it's more likely than not, I haven't seen the hard numbers, but it's reasonable to assume that those 400 that are being delivered elsewhere carry with them private insurance policies to go out. Well, that would be a very valuable revenue stream for our hospital. That's why this is a very important question. Now, the Cleveland Clinic is investing, I want to say $8 or $9 million currently in the labor and delivery department. I think that it's important. I would encourage the members of our community to express themselves. I'll tell you that our meetings could be better attended by the public, so that we can hear from you. As a matter of fact, toward the end of the year, last year, there was some discussion that, well, we must be doing everything right because we don't hear it from anybody. And so I would encourage, folks to show up and fill us in. Let us, give us feedback, shoot us emails. If you go to our website, there's an email address. You can direct emails to the trustees to let us know directly what you think and what your priorities are, so that we can consider those. I think that would be very valuable and instructive.
What time are the meetings?
So our meeting schedule is as follows. Thursdays, we have our board meeting, and that's at the County Commission chambers at 4 o'clock. The Wednesday before that third Thursday, we have what's referred to as the chairman's meeting, and that's at 10 a.m. at the district's office on State Road 60. It's on the west end of the Twin Pairs on the eastbound lane. That's in our boardroom, and it's the chairman's meeting, and that is both of our meetings, I think, are accessible. They are accessible by Zoom. So if you were to go to our website, find the link, you can find the information to attend by Zoom, even to make it convenient for you.
So what I wanted to ask you also is, let's discuss the $3.8 million purchase of a 30-bed women's sober home. And, a recent guest who runs a Vero Beach sober home came on the board report and confirmed the need for a women's sober home. What can you tell us about that subject and where it stands with all the trustees?
where it stands now is we own the property. Having the benefit of knowing the zoning, we've got a zoning problem, quite frankly, because if you look at the applicable zoning for the property that was purchased, it precludes the provision of healthcare related services on site. So had we been, quite frankly, had I known that at our meeting where we were told that the contract had been signed, I asked, what are we going to have a zoning issue? I was informed that we were not. Made the observation that I would, I want us to err on the side of a broader scope of what would be allowed. And for whatever reason, the inquiry that was made wasn't thorough enough, quite frankly, in my view. And as a result, we own the property. Fortunately, Dr. Wayne Creelman, who has attended a couple of our meetings and our May meetings, he had done some of his own legwork and has found some outside providers that we might be able to work with. The difficulty we have is if we're going to fully use that property, it probably is going to warrant a zoning change. And that was discussed at our last meeting. So that's going to have to get looked at, quite frankly, and how we're going to, put that property to good use. It was previously, I believe, a children's home, so it has some, dormitory suites component to it. So in other words, it's physically, it's a suitable property for something like that. The question is, can we get it done there and not have a zoning problem? Secondly, is if the work that Dr. Creelman has done for us, that if we've identified an alternative source, because ideally, I would prefer that the trustees of the district not be involved in the active delivery of services there. Perhaps finding a third-party contractor where we would do a fee for service. In other words, if somebody allow for so many beds in a particular facility that would be available for indigent patients that would meet the requirements for an indigent, then we would fee for service. Means that as the service is being provided, we would get billed for that. We would make sure that the patient is appropriate for the indigent care, and then we would get invoiced for the service. And the nice thing about that is then we're not carrying overhead, we're not carrying ownership, but we're still in the process collectively, all 7 of us, through staff and the volunteer committee, looking at on what to do to provide that need, and whether or not, in light of the developments, that property is something that we need to continue to try to work into the treatment capacity for our community, whether or not it should be something that we're doing.
So when you're talking about indigent care, does that mean you're no longer talking about a women's sober home?
No, it would be women's sober home for the indigent. Okay, and so what was going to happen for us would be focused on sober home for women, providing indigent care. An alternative would be, and that's what's being currently explored, I think, that Dr. Creelman, if I understood his comments a month ago, would be that finding a private provider out there that is in the community that fee for service, we would go to them and say, can you allocate 7, 12, 10, however many beds in conjunction with what you're doing? And assuming the patient meets the need, the indigent level, that we would provide the funding for those patients that are residents of the county that need that support. And that
So
way,
are
go ahead.
my next question is, are the trustees aware with what needs to be in a sober home and what kind of care needs to take place for those people attending that sober home? So when
Well,
you're hiring a contractor, are there going to be licensed people, and how are we going to make sure that the tax dollars are being, I mean, are you guys evaluating all of that? Do you have like a table that says, hey, this is how a good sober home runs, this is the mental health? Because a lot of these people might have drug habits, alcohol, and how are they going to be cared for? And are they going to be cared for by licensed people? Because some sober homes have people in them that run it, but then the people that are staffed in it are not really educated in the fields.
Yeah, anybody that we would do business with would be a licensed provider, and that's actually a requirement under the special act that created us. That any health and medical services that we provide be provided under the supervision of either a physician or somebody appropriately licensed to deliver whatever the relevant service is. So that would be part of the request for proposal that would be put out, that whatever entity that would provide those services would be appropriately licensed.
Okay, we're going to need to take a pause here and head to a commercial break, and then we'll be back with Paul Westcott and Sheila Matthews.
Warrior Shield Foundation is here to unite, honor, and provide support for veterans, first responders, and Gold Star family members. The foundation will enable them to find the help they need through direct assistance or by connecting them with our shared vision network. Using data-driven models, we provide solutions that make a long-lasting difference. We, along with our partners, are dedicated to bringing together like-minded groups and individuals who have committed to making a difference in the lives of our hardworking, everyday heroes. We bridge the gap by connecting warriors or their families with the assistance they deserve and require, such as service dogs, wheelchairs, counseling, scholarships, and team building retreats, to name a few. You can help right now to make a difference for those who have helped and protected us all. Warrior Shield Foundation, selflessly doing for those who need it most.
It's a long way to home, but you won't take the hard road all alone. Just look to your left and look to your right. You were born to fight.
Indian River Connections brings you the first source you can watch for truth on board decisions in Indian River County. The Board Report, where taxpayers and policymakers intersect. Be sure to subscribe on your favorite platform to get notified when we go live on Fridays at 7 p.m. Visit IndianRiverConnections.com for more.
Welcome back to the Board Report. I'm Joann Binford, and I'm joined with Paul Westcott, Hospital District Trustee of Seat 5, and Sheila Matthews, co-founder of AbleChild. Hello.
Hello there. Thank you.
How are you? Yes, thank you for joining us. How have you been, Sheila?
Very busy, but really good, healthy, happy. So I'm glad to be on with Paul. You know, I ran for a seat in Indian River for the district and got 48% of the vote. So I do believe I carry some weight on what I say here. So I'm delighted to join the conversation.
Yeah, so we left off discussing the hospital district, which is right up your alley, Sheila. And I know you have been working with Cleveland Clinic in regards to the MedWatch system. What can you tell us to fill us in?
Okay, so when the board or Paul, and I know he doesn't speak for the board, I do want to make that clear as well. They talk about treatment and mental health treatment. The treatment is psychiatric drugs. It's a combination of behavioral health techniques, but most of it is psychiatric drugs, and that's antipsychotics, antidepressants, and they carry a black box suicide warning, increased risk of violence. And when I presented before the board, they had really, they don't understand, to be honest with you, what MedWatch is. And they're not alone. The country, only 1% of people even understand what MedWatch is. And that is the consumer's adverse reporting mechanism, where the FDA takes the information, like if somebody has a psychiatric adverse event from Paxil or Concerta, especially in children is where I focus, they can report it through the MedWatch system. That information is then collected by the FDA. The FDA then regulates the drug companies. It's like, if you think of Superman, it's like kryptonite for the consumer, not against the psychiatric and drug companies, but to hold them accountable. So what I did was I went to a meeting where the head of the Indian River board was holding, I want to say, a damage control, because they were sued by a psychiatric patient at the hospital that I believe killed somebody. I don't know the details. There was a legal battle over it, and they ended up, the hospital, Cleveland Clinic, ended up getting off on a technicality. So I presented to Dr. Rothman, is it the CEO? I'm always dealing with so many.
Richard Rothman, I think
Yes.
it is.
And publicly, and this was 2 months ago, he stated that he would consider implementing posters on the importance of MedWatch. And that's really huge because no other hospital in the country has done it. It's an unknown program to the consumers, but the FDA regulates this program. They create posters and consumer pieces for the MedWatch program. So he basically publicly said that he would be happy to put these MedWatch posters within the hospital. And then I followed up. I wrote this article about it. I thought it was really great that the hospital would do that. And it really would help with their liability, because what they're doing is they're pointing consumers to be more educated. And so we got an email, please let us know what the poster's about. I sent them the actually official FDA MedWatch posters. And I heard back from the legal team saying, well, we don't post third-party posters. I'm like, well, it's from the FDA, and you're required really to report as doctors to this program. There are mandatory reporters. So she didn't say no, but they have to go through this entire legal process. I do want to give them some time. It's been 2 months. I am going to stay dogged on it because of the importance of safety. And then, also with the budget numbers that Paul was talking about, and when he uses the word treatments, these are numbers also that should include what the taxpayers and the hospital districts are approving regarding psychiatric drugs. It needs to be a separate line. I did go through their budget. I think there are a couple on what they spend on medications, on mental health medications. So with that said, I think what I see is this board and the hospital not just blanket approving mental health treatments. People come in with these programs, and I don't really feel that the board is educated enough on the deadly side effects of these and how they're increasing the crisis in mental health, if that makes sense.
Right. Paul, what what role of the trustees could they play in something like this as far as bringing this subject up amongst all of you?
Sure. So give you a little historical context. With regard to the transition with Cleveland Clinic, what I have observed just in the 2 years that I've been on the board, and then because of that experience looking backward, is there's, I would just refer to it, and not to trivialize it, but to give you an idea, I would characterize growing pains. And the growing pains are this, and this is going to get back to where Sheila is tax dollars that are now available, people with good intentions wanting to address needs to be filled, coming to the board and evaluating them in the context of a broader perspective of elevating the healthcare in our community. Okay, so as a big umbrella mission. As a result, as you probably some have seen last year, our budget kind of blew up, and so this past year we've developed an approach that, okay, we've got 3 goals that are more focused on treatment and medical services as opposed to things that may improve overall health but aren't necessarily treatment. So we're beginning a process now of implementing a plan that's going to get us there. Well, when we started the budget process this cycle, I went to the statute on this particular topic. And again, I noted that for our financing that we're doing under the statute, it has to be health and medical services, which means items or services provided by or under the supervision of a physician or person trained or licensed. Okay. That is a much more focused approach than what we're currently doing in some areas. Now, back to Sheila's observation in terms of our engagement in, I'd say, the day-to-day usage of medications and what we can do there. Behind our funding, we can set standards. And Sheila, I would invite you to provide us some direction in how we as an oversight umbrella agency can create standards that are not going to interfere with the doctor-patient relationship, because that's the dilemma that we have is, at some point, are we invading the responsibility of the doctor to the patient with what we're doing? And I think measurable standards and data collection may be an appropriate way to do that. In addition to that, is because the way that we're removed from the doctor-patient relationship, HIPAA creates some barriers for us and some complications as well. So I don't think that it's something that we ignore, but it is a complicated topic for us to engage in.
Well, in response to that, I have to say I did go to your meetings, and I love going to them. Frank actually broke a HIPAA law when he was reading out a statement about a girl that was treated, and he was using her story as to get more funding. And he was advocating, and I could get the certain meeting and what he said, but you can't use HIPAA to promote treatment and get more funding and then not use HIPAA to inform the consumer. And that has nothing to do with interfering with the doctor-patient relationship. It's called informed consent. The consumer has a right to know in a hospital that they have the right, because the drugs are being used within the hospital, and you are approving programs, mental health treatment programs in the community. You have a right, you have to point. You're not saying drugs are good or bad. You're giving them an avenue in which to report side effects. And the FDA wants to know those side effects because they regulate the drug companies. So you can't do medical devices and have medical salespeople come in and promote all these things in the doctor's office about different products for asthma and all this stuff, and then not tell people about informed consent regarding MedWatch. It's not an interference. I did mention it, and I'm happy to work with the board and direct them. I'm still waiting for the legal response from the head of the hospital. I will follow up with that. And the other thing about the sober house, just to flip into that, because I know we're short on time here, not only my organization, but multiple organizations came before the board and told you not to buy this property. So I understand you're navigating and trying to make it work, but I have to tell you, I will be down at the zoning board. I will be telling them, absolutely, you cannot change the use of this property. Taxpayers, then the hospital came to taxpayers and said they wanted a bailout. That's how I ended up at Dr. Rothman's public PR, quelling of the taxpayers. You're a special district and you're increasing the funding, the taxes on us without any accountability. We didn't need this sober home, and there's multiple ones with already abuse in it. There's Alcoholics Anonymous, which is free. There is Al-Anon, which you should be promoting at a board, because those are free programs, and that would help the district.
Well, Sheila, just so that you know, our recent meetings, we're moving away from more than likely the sober home being done. And anything that may take place there is more likely it's in development stage. In other words, there's a committee that's been put together looking for a way to address the need and what's the most beneficial and appropriate way. And I think the meeting you attended, I remember you being there, we'd already closed on the property. In other words, it had already been done. And like I said earlier, had I known the true nature of the zoning issue, I would have said no, quite frankly, just to personally address that. And I did ask at the October meeting when the contract, it was announced that we had a contract. I asked and I said, I want to make sure that we're going to be able to do what we want to do. And that if anything, I want to err on the side of it being broader than what we currently plan, because we're going to have a very valuable asset. Let's make sure that we can make the most of it. And I was assured that the zoning was not going to be a problem. Then fast forward later, and I take, look at the zoning and I see the language, explore why we didn't know. And I found out that our council had not written letters to the zoning. It is a very simple process. For $75, a letter from our lawyer would have gotten it clarified, where we could have delineated every program that we were contemplating doing that would be in a request for an RFP, and the zoning department would have been fully informed and would have told us. That would have been part of our due diligence on the front side before we had a closing. And unfortunately, that did not happen. We did not get the letter from the zoning department that we needed in order to confirm whether or not it was appropriate. So now we have an asset, and we're going to explore whether or not, and we're on the front side of looking at how to use it if it's usable. Part of that process is looking at private sector providers in that arena that would properly licensed, that would be fee for service in order to meet that need. And yeah, and on the other side, on the efficacy of psychiatric and other drugs, you're a valuable resource. And if you have resources that we can use, I'd like to incorporate that in our forward-looking processes that we develop.
Yeah, the FDA is a valuable source, and the Secretary of HHS, Secretary Kennedy, is doing a lot of things on safety and effectiveness. But I think overall, it is an asset. The sober house, flipping back to that, you can sell an asset and say we made a mistake. It might be cheaper to just resell it and be like
Right.
off, and give the taxpayers back that chunk of money. That's really
I'm not opposed to moving that direction if we can't really. In other words, what I don't want to do is have a solution in search of a problem. In other words, oh, here we are. If it's not going to meaningfully make an improvement in a level of service of something that's actually needed.
It's a suggestion, Paul. And
yeah. And I'm one of 7, like I said, and I haven't gone there yet. I have, when a few meetings ago, when I don't remember, it was a chairman's meeting. I went through a litany of questions. Where were we on the inquiry that was made? And in terms of how do we get here that we own an asset, a property that has in its zoning that we cannot do healthcare related services on premises. Okay, well, how are we going to provide mental health services, counseling? That's healthcare, and if it's healthcare, we're susceptible to challenge if we bring patients in there. And it's ludicrous for us to have people living there and then have to go off-site for the counseling. That's not a viable option either. So if it turns out that there's nothing meaningful that can be used, and like I said, we're at the beginning stages of exploring what to do next. We'll see where it goes, and the market's kind of flat right now, and so we can afford to sit on it for a little while and let the market come up if we need to.
Well, I really appreciate. The other suggestion is, to hear that Frank has not responded to a media request, that would be something I'd ask you to take back to the board, because, the board report here is the media, and, he should be responding and doing media pieces when people ask him to. So I would encourage that, Paul. And your time and your energy has been you're so open, and I love working with you. And I think Frank sold us a bag of goods on this. I'm going to be honest, and I think you should come on and talk about it.
Well, the process was well on its way before he was our executive director. Okay, so he inherited that project from someone else. And just for those, like I said, if you go to our website, we all have email addresses, and you can reach out to each of us individually. If there's something going on that we need to hear about, by all means, you can email us. You can come to our meetings. You can Zoom into our meetings. I appreciate the input. And on that point, this is going to sound, one thing I've noticed in the organization, well-intentioned people in it and around it. What does that mean? Well, these are folks that really have a genuine interest in meeting the needs of our community where healthcare is concerned. And in a lot of ways, a lot of gifted, concerned people. But there hasn't been community engagement. So to some degree, there's a bit of a bubble environment, if that makes sense to you. And again, that's nothing derogatory about anybody that's involved. It's just a development that's occurred. And what will be very healthy and helpful is if we hear from the community more on what the priorities are, what the needs are, what the difficulties are. I like to try to solve problems, and I think that most of the other board members, or all the other board members, I'll say it that way, have the similar interest. And if we're not hearing anything, we don't know that it's necessarily that it's broken and needs to be fixed.
Well, I'm happy to help and be a voice in the community. You know, when we're getting pitched on cuts in Medicaid, but we're looking, I think, from the consumer's point of view, to clean up the fraud and the abuse. A lot of it is heavy in mental health. The last thing we need is a mental health facility, another one. We have to clean up the hospital's mental health approach. You had, you know, somebody killed in the hospital settled, didn't settle. They got off on a technicality. So I really want to emphasize the importance of safety, but I will do my part in the community, Paul. And
yes, well, and you know, the Parkland shooting really moved the needle, and there was a reactionary environment in our community. The legislature did some things on gun rights as a reaction. So I prefer that we have deliberate responses to problems. Okay, and that is, let's figure out what happened. Let's figure out why it happened. Let's figure out how we can address it, and be deliberate about that. I know you're kind of the same way in terms of what role are the medications playing in this.
Exactly.
You know?
I think that's the biggest thing, and I think that's where Sheila brings it big, you know, to the table, is the medication part of it. I mean, I'm a perfect example. My son was on those medications that she discussed earlier in the show, and so that I've seen the effects of what that takes. And so we have to, like you said, we need grassroots. We need people coming to the meetings, expressing their opinions. That's why the board report was developed, where taxpayers and top policymakers intersect. That's what we do. This is why this is done. And that's why we appreciate you coming on the show, Paul.
Appreciate
doing this, because this is what the whole purpose of this is. There's nobody doing this in our town, in your county. Nobody's doing shows like this. They're doing like little fancy shows and things. They're not doing, you know, stuff that people don't really want to listen to, but they don't want to go to the meetings at the same time. So we cut to the chase and we try to bring it to you. What's going on at these meetings, especially school board meetings and things of that nature. People coming to the table. That's where I came into this mix. That's how you and I met, was coming to these meetings, showing up. That's how Joann and me and Mike and all of me met, is how we all came together to do this. So that's my 2 cents for that.
Right. And again, for those of I am just one person on a 7-person board. Yep. I cannot speak for the whole entity. I've shared some views probably that are, you know, I can't say which ones, but are probably minority views. But you know, the board does work with me, listen, and I'm going to keep trying, and it's a growing process, because it's a new environment than 10 years ago, than 5 years ago, and we're learning, in my view, as Cleveland Clinic is becoming a bigger part of our community. Them learning us learning them, the district understanding how it can exercise its oversight responsibilities in an appropriate way. You know, that this environment, Cleveland doesn't want us to run the hospital. I don't think you want me, a lawyer, running a hospital. Okay, I don't want to run a hospital.
Nobody wants to run a hospital. I think that's what they say when we challenge them with safety issues or accountability or taxing. They're like, well, we don't want you to run the hospital. We don't want to do that, Paul. What we want is safety. We don't want our taxes to go up. We want them to be competitive too. One quick question I have is, how is the new hospital in Sebastian going to impact Cleveland Clinic?
So they're a not-for-profit. We don't have a contractual relationship. They're not part of our platform, if you will. The current lease agreement arrangement for the first 10 years of the lease, and we're in year 6 now, we're not allowed to compete. In other words, the district can't compete with Cleveland Clinic. So our ability to interact with the Sebastian Hospital is somewhat limited, but I think what's going to happen, I was glad to see an entity like Orlando Health, because they are a not-for-profit. So what we have now in our county are 2 competing hospitals that are on an even playing field. Your for-profits have an advantage to some degree over your not-for-profits because of the configuration of the patient base and their ability to generate revenue. So now Cleveland Clinic has a competitor that they want to do good work for us. I've never assumed that they don't.
Right.
The problem, one of the problems is a lot of their leadership comes from Cleveland, not from Vero, or not even from Weston. That Weston does play a role in leadership. But now that we've got a local hospital to compete with, Dr. Rothman, who I was very happy to find him taking over, to have him, because he's been in our community for 14 years. Okay.
He's very nice.
Having Orlando Health come to town may complicate things for him in the short run, but I think in the long run is going to create an environment where he's going to have a little more sway, I hope, in Cleveland. A little competition is good. It's healthy, and it's going to be good. The fact that they're competing with Cleveland is going to be good for them, and back and forth. So I think overall, in the long run for our community, having that particular organization come to our hospital, being on a level playing field because they are also a not-for-profit, is really going to be beneficial for us.
All right, guys. Well, we got some people in the green room that want to join the panel in this conversation, so I think we should go ahead and go into that segment, and I'm sure they have a lot of questions.
Okay.
Hey guys, just let me fix it because we've had Thomas join us. Hi, Paul. Hi, Sheila.
Hello.
And I believe Joann, she had lost power, but she is back with us also. There we are.
Nice.
We're all here. We can't hear you, Thomas. I think you got your mic muted. Anyway,
can you hear me now? Can you hear me now? There you go. Hi, guys. Sorry about that.
Oh, you're good. I think
don't ever spill your drink on your electronics. Okay, I just want to tell you that.
No, I keep mine elevated.
Well, it's after 5, so it's okay.
Your drink.
I think that's a great conversation. The common man and woman, I think, in our streets and our neighborhoods probably has no idea there's a hospital district at all. They, let alone what they do, when they meet, and what their responsibilities are. I mean, me for one, until we started doing this kind of show, I had no clue. It was actually sickening to find out how many taxing districts we actually are subjects of. And I don't know. I'm not a professional. I'm not into what Sheila is and what you are and the sober homes and just the running things like this. But I just don't see why the taxing district would have to get into the business of providing that health care, like owning the sober home. I mean, what would be
good question?
I don't understand. I think there would be more benefit in supporting another organization, maybe, that could administer that.
So what happened? When I first came onto the board, the conversation was kind of already started, and the need was, women who are between, active detox and being on their feet. There was a perceived need there, a hole there, which is part of the continuum of care for drug rehab under a lot of circumstances. So the idea was there's a need here, we need to fill it. Again, the way it was communicated was that the providers that would be out there would find it difficult to come into the community if there wasn't a property that they had access to. So the idea was, we're going to get the property, contract with somebody to come in, and they're going to take over it, or they're going to do it in a way that may be hybrid, patient-based, that are private pay together with indigent patients, so that at that stage, this private entity would fund the whole thing. And is that part of our our mission under the, if there's medical treatment being provided, it could be, if we choose for it to be. The district, if you read the statute, the way the statute's written is primary focus is the administration of a hospital. Secondarily, general elevation of healthcare in the community. Also, generally, is the elevation and provision of indigent care, treatment for the needy. So it is a valuable organization if it's providing indigent care appropriately, because I think that local eyes and ears and hands are always preferred, more likely going to be more efficient, going to identify the real needs as opposed to coming from Tallahassee or Washington.
I don't mean to cut you off, but something like this, getting into this business, I would only see the cost going up and taxes going up to support that. Is that right? I mean, it's not going to make any revenue, is it?
Well, if it's a hybrid environment where you have a for-profit entity that has insured revenue-generating beds alongside of indigent beds, okay, then the plan would be allowing that operation to carry the cost of the indigent beds as its overall operation. Okay, so for instance, Treasure Coast Community Health operates that way. They take private insurance, they take private pay, and they provide indigent care. Because of our statutory mandate, we pay for services provided to the indigent care as well through them. But you can have these hybrid situations that can work well for the community. Okay, is our community big enough? Is that facility have enough beds in it to justify that? That I'm not sure, quite honestly. So I scrutinize. I'll be honest. I scrutinize that purchase, and I'm going to be careful about what we do with that.
Right.
Where we are now.
Before I ask Thomas for his input, I want to ask Sheila real quick. Let's say we sold that property tomorrow and the board asked you what to do with that $3 million. Where would you see that money best? And if we were going to talk about supporting sober women, where would that money, do you think, would be best served?
Well, I don't think there's a need for supporting sober women. I think that there's an abundance of programs already out there. I think that I would cut away of more of the mental health and get into the physical care of the hospital, like the newborns. I would see getting a specialty, really letting the hospital run itself, but based on that money, I would like to see it improve the physical care versus mental health, and treatment is so subjective. And all this money is coming from federal grants for these vendors to come in, these third-party vendors to come in. It's especially like Paul said, after these mass shootings, these grants were in abundance. They smell the money. They're coming here to get access to the poor and the suffering. I would try to take that money and do nutrition programs. I would do tutoring programs. I would put it more towards giving the hospital new equipment and new technologies. I would move away from the mental health because I think it's filled with fraud and abuse. And I would like to see the numbers they base this decision on. I don't think there's a need. And as I'm going to be honest, as a sober woman myself who went through a process, you don't want to house women and pump them full of psych drugs. You want to get them in programs. There's a bus program, and Paul might know this, that provides skill building to get them back into the workforce. You don't want to, there's no psychiatric drug that is going to get somebody sober. It's just not going to happen. That's false science. So I'm very apprehensive to allow this mental health to spread without the accountability and the budget of where they're putting the money already. And like Paul said, the outcomes. What are the outcomes of these programs? How many people have gotten better? And again, Frank, read a story about somebody who received, a young child who received mental health. Let's hear more than a story. Let's see some breakdowns in the numbers. So that's an excellent question. I think it needs to go to physical abnormalities that you can measure, blood. And we have an aging population where they need a lot of help, but young people we want in the community.
So real fast, just our current goals that we've developed in past year. So I hate to, sound squishy, but we are evolving. Since I've been on the board, there has been an evolution toward more physical treatment. And, we're in the budget cycle. We've got a meeting coming up July 10th where we're going to start going through our priorities and some of the funding requests. And this is going to be a big conversation for us. I am gearing more toward, transitioning to actual medical services as being our priority.
What I was going to ask you.
Yeah. So our goals expand access to primary care and mental health services in Indian River County, expand access to essential healthcare services for the uninsured and underinsured, and develop and implement high-impact preventative health initiatives. So, and for me, I'm looking for physician. I'm not sure it's physician-directed treatment. If it's a non-physician, but a medical care provider, properly licensed, credentialed, I'm looking for more service-related expenditures than some of the things that we're currently doing. Now, what does that mean? We're going to have to make a shift away from some of these programs. What I don't want to do at the same time is create a crisis in certain instances. For instance, Meals on Wheels is one of our funded agencies. I don't want to create a starvation environment. So, that one we need to look at. And if we're going to move away from that, it's going to have to be a graduated methodology to allow the agency to find alternate funding as we back out. And there are a couple.
Paul, can I ask you a question?
Sure.
Because I have that report you wrote. It's an 8-page. It's got the special act in there, and you define the health and medical services per statute. And you're talking in here that there's roughly $4 million that can be saved and reapplied to medical services that Sheila was talking about. And just so you know, you've got the Learning Alliance doing a prevention program with a technician, and they're getting $155,000. I'm like, what is a primary 501c3 that deals in K-3 literacy? What prevention program are they running?
So I will tell you what, with that particular program, what appealed to me was this: providing training in the schools to redirect Johnny, who is just being a 10-year-old boy.
Yeah, but that's education. That is all that is. I understand what you're saying, but it's an abuse of the language of the statute.
Let me finish the thought. So providing training for, I no longer believe it's within our mission. Okay, at the time that I was looking at it, I had not looked at the statute in this regard. My attention for my first couple of years, if you follow anything, was very different than now. This was a process that was well in place. We were hearing, there are a couple different places in the statute. There's one that's a little more generalized, providing the general health care of the county as being the language. Okay, that was frequently being used as the operative discussion point for funding. So this go around, in light of our transition, I said, there's got to be more in the statute. So I looked at the statute and I found what you've read. So that would be a program that, in my view, we would be moving away from. But at the time, it appealed to me because it was going to do this, among other things: facilitate a process where Johnny, who just is being a 10-year-old, active, rambunctious, not being treated as a psychiatric issue. Okay. So in other words, going into the school system and teaching the teachers and the counselors to look at a behavioral issue differently so that it didn't result in unwarranted treatment. Okay. So at the time when it was given, okay, I can see that it's maybe not healthcare because you're not directing a kid through a system that's going to drug them, but at the same time, you were educating that. But at this stage, it's not a program.
It's never healthcare. It's not healthcare. There's no licensed physician here. You got a technician who gets certified in BH, I think is what it BH
Thomas,
behavioral health technician. What does that mean?
Well, Thomas, given my current understanding now of the mandate under the statute, I'm in agreement with you. Okay.
I know, it's just frustrating from the outside. For I think Sheila's got she does it with a better smile than I do. So the reality of this is that I deal with this over at Children's Services Advisory Committee. They in 2022, while holding the tax level the same, they expanded the definition of terms, and in here God bless you for doing this, because you said, look, this is our mission statement according to statute. We provide health and medical services, get the necessary machinery, get the necessary technology that reduces the cost of indigent care. So Cleveland Clinic isn't coming to you for $16 million. So, these are the things that you do. And I think you should do and there should be defined parameters and boundaries on what people can apply for. Mental health education, stuff that Thrive Incorporated does, between you and CSAC, they're over $1.1 million in grants. It's insane.
So anyhow, my hope is you're going to see in this cycle and the coming cycles a transition for the trustees with a more defined focus. And the beneficial thing about that is we're going to serve the community more directly and do what we're supposed to be doing, which is elevating the medical treatment in the community.
Absolutely.
And quite frankly, as we've been doing this, you know what else we've been doing? We've been letting some other entities off the hook. By that, I mean other units of local government. I won't get into, the legislature. I'll go into one. The legislature decided to stop funding the mental health court. So in an emergency situation, we were asked to fill that need, and nobody has stepped up. But what I've seen out there is we've got drug court and we've got mental health court do very similar sorts of things.
Right.
Can you explain mental health court for viewers real quick in 1 minute or less? And me.
It's a way for a judicial system to direct somebody to receive what are believed to be appropriate services. And Sheila's head's going to explode when I just finish saying that. But that's and there's some people that probably need a stick to help sort things out in a way. That's kind of a terrible way of saying it, but I mean, but it's a way to keep them out of the criminal system. It actually is beneficial because if done well and right, and it can help with the family law court system as well, because the family law court system, the dysfunctional parents, a lot of times there's a drug or behavioral issue that needs to be addressed as well. But the types of things that the mental health court does and the drug court are similar enough that there could be an economy of scale. But it's a judicial system that is outside our statutory definition of health care.
And we used to have one court. And this is what mental health has done. It's seeped into our schools, in our courts, in our religion, and they're the arbitrators of what is good and what is bad. and they're causing the big ripple. And, Paul, I think you're doing a fabulous job. And I think that the board, is on a learning curve. God put me in this position to live in Vero Beach. I would be happy to educate you on mental health and my concerns on human rights, and try to, the money factor is, you feed it, Paul, it never ends. It never ends because there's no definition. And when you get somebody in front of a drug court, that's when your liberties are stripped. We have one court system, this whole creation of the mental health courts and the drug courts. We're moving away from the Constitution, it's just.
Well, those are systems that are largely diversionary. In other words, the person gets to choose. It may not feel like much of a choice. Do you want a path that's going to put you in jail, or do you want a path that's going to do well for you?
Right. Or become a pharma client the rest of your life. Sometimes it's easier to take the 60 days in jail. But obviously we're all trying to help, and anything AbleChild can do to inform. We don't want to fight. These are all our tax dollars, and I think our approach is, we want the board members to come on this show. We want to open dialogue because the taxpayers are paying it, and you guys have the power to increase our taxes. So we don't want to be at the mercy of you. Thank you very much. We want to be in the conversation.
I don't want to be a burden. I do not want to be a burden. So,
Paul, you're welcome here anytime. I'm
here.
just glad you had the courage to come on, because not many people in elected positions are willing to come on and take the dialogue. I say, Paul, for mayor of the hospital district.
Like,
is that a thing? No.
So I've been perceived as being critical of Cleveland Clinic over the past few years. I think Dr. Rothman is doing a great job, and I try to support him and help him every way I can. One of the pressures that he has, and the school district has, the school district is, I'm going to kind of swerve into Thomas's lane. The school district is dealing with a desegregation order. Okay.
Oh, don't get me started.
To the extent that's an issue,
hey,
that's a community issue. Okay. To the extent the demographics in our hospital has the allocation that it does, that it creates the financial pressures that the Cleveland Clinic has, that's a community issue. What are we doing for our middle class? What are we doing to provide economic opportunities for our middle class in our community with light industry, whatever it would be, to create better paying jobs so that we can have jobs that have health insurance attached to it?
Joann, people are starting to understand your campaign.
Yes, I was screaming that through my campaign, and they said, "Oh,
right,
you should."
That's the second time in 2 days from two different people saying the exact same thing.
The balancing act that we're going to have to do is our community is, if we're completely no growth, it's still going to happen, but it's going to be apartments and condominiums, okay, and high density places. If there's got to be a way that, and there is a way that we can look for light industry, and a rising tide raises all boats. And I've shared this with a few people. My favorite movie is It's a Wonderful Life, and we can have Pottersville, or I can't remember the name of the actual town. And what I say it that way because one is a very coarse.
Bedford Falls.
Bedford Falls. Thank you. We can manage our growth. And what does it do? Well, like I said, economic opportunity for more of us, more insurance. Our hospital is solvent and functioning well. Greater opportunities in our community. We see some of the pressures that exist that create some of the disharmony that want us, I'll say us very broadly, want us to have a desegregation order dissipate, so but we got to make the choice, and a no growth, zero growth is just going to exacerbate things. So we got to figure out how we can
I agree. What is your opinion, though, on the economy for our middle class in our community right now? Because, I mean, how many more millages can we afford when you have
well,
a sheriff
it's,
wanting to raise it one
well,
one millage, and then,
well,
obviously this is going to cost more down the road too if we get into the business of
when I
sober home.
ran,
While housing increases.
right, when I ran, and the COVID experience and the elevation of property values allowed local government to not have to raise millage, but the revenue was still coming. Okay.
It's the case now too. I mean, for example, they funded increase for CSAC, because I've been studying it lately, 15% without raising millage.
Right. And so the benefit of having a higher, a healthier middle class is you've got a better tax base, and you can carry you've got more shoulders to shoulder the burden, and again, I don't think we have to sacrifice our quality of life to do that. I think that there, with intentional, thoughtful approach. But it's difficult because we have such a beautiful, wonderful place that understandably there are a lot of people that, wait a minute, we don't want to have any growth. And I don't think that's healthy for us. We got to find ways to replace the citrus industry, good paying jobs, because those good paying jobs will make a big difference in a lot of different ways.
Well, that has everything to do with your quality of life and your ability to pay taxes, your ability to invest in your community. If there's no jobs, and that also brings more jobs, brings different health care. We have a large percentage of retirees here that don't have private health insurance. That's killing the hospital district. If you have young people. If you have young people with families, they're going to have Blue Cross Blue Shield, they're going to have PPOs, and then you have a NICU, a better baby care. They're going to have their babies here, but you can't have a growing young community if there's no place for them to work, as housing keeps developing and the prices of housing keep increasing. We've got a sheriff department or fire department that has a top-notch training program. Everybody stays there, and then where do they go? They go down to Port St. Lucie, Martin County, because their training sucks down there, but they're getting the best qualified people from us to go down there because they're getting paid more money. Our guys make like 40, 50,000, while their guys are making 60, 70,000.
So,
I mean, there's that one officer, that deputy that left. He was a school resource officer. He's making 53,000 after 3 years, and he goes down, takes his time with him, comes in as a 3-year guy in St. Lucie for the exact same job, makes a completely perfectly lateral move, and makes $26,000 more a year. So that's a 50% increase in pay for a lateral move 12 miles away. You can't beat it. 79 grand.
The teaching hospital also is going to be a big value plus for Vero Beach. Right. What we need to do is have these people that are coming in, these young doctors that are going to be training at Cleveland Clinic, to give them incentives to stay here. You have to you have to stay after, your training for a year, and then getting volunteers to young people to get involved in the process. I like this whole concept of boards running everything, but if, like Paul said, if we don't get young people engaged in this process and get them educated on how to run things, we have to learn how to pass the baton. We don't want these boards to become stagnant. We want people to leave the boards, have fair elections, and come back in. And I just think that we have a lot of blessings in Vero Beach. I think that Paul on the board is a good eye for the consumer. I always do like the way you speak to people. I think you're very open to listening to solutions. I do like the chairman or the new CEO. I would ask him to, follow up and put MedWatch in the hospitals. I think if we...
How can people at home, Sheila, help you? That's what I wanted to ask you. How can we help get that poster in the hospital? And not just here, right? This is something valuable for every hospital.
It would be the first hospital in the entire country. It would shine such a light on Cleveland Clinic, and they have such a broad, like Paul was saying, they're from Ohio and they're around the country. They're a huge hospital. They're not hurting for money, and I'm sorry they are not profitable, but it's certainly not the consumer's fault. So,
well, you said something too about having all those intern people, doctors stay. So remember, your top 3 employers in this county are your school district 1, the hospital 2, and the county government 3. We're, I love medical. It's a high paying job, but most of these people don't stay. They become contracted. They move. They do their thing, and that's fine. Yeah, but we need real jobs here.
We need
that work. We need industry. And, we talk about, well, we don't want the growth. I mean, they won't even give a guy a 10-foot raise on a roof to put in some modern stuff at the mall, which is just, they can't even replace the light bulbs over there anymore. It's silly. And everyone's like, well, you put 10 feet on the roof and then everyone's going to want 20 feet. And it's just nonsense. You know what I'm saying? It just doesn't make any sense to me. And it doesn't allow for middle-class people to have a place they can call home where those things that matter to them are allowed to flourish. Whether it be types of markets or all these different types of small businesses. Everybody tells me, hey, go here in this county, go here in that county, because the only thing you can do here is get your car washed.
Yeah, like US 1 could be such a beautiful place for businesses and places to go, have young people go and dance, restaurants, businesses. But when you go up down US 1, you see car washes, or you see storage units, or you see,
Dunkin' Donuts.
Yeah, it's like... Where do you go to hang out? You got to really drive out of Vero Beach into Sebastian, and then out of Sebastian into Palm Bay to actually start running into places where you really want to hang out and go to.
And what can we convert the packing houses to? We've got these assets that are sprinkled all around the county that would, for light industry,
that are just falling apart.
Right.
Yeah, they could become restaurants. And, Paul, you had said something really valuable that is really, really important for Vero Beach, and that is the citrus industry. I mean, we really have to look at that and say, what happened? How can we figure this out? Because we are losing groves and groves, and it really, that's what Florida was all about. So I think that is an important thing. But everybody has great ideas, and then you form a committee.
Right.
Nice and committee.
The board report's a committee.
Yeah.
Well,
not funded by anybody, though.
No.
Except House of Champions.
I apologize. I need to take my wife Kimberly out to dinner.
Oh,
thank you, Paul. Thank you. We really do appreciate
the opportunity. Enjoy the conversation.
Thank you.
Thank you, Paul.
Your faces. All righty.
Tell Kimberly
you.
we love
Appreciate you,
her.
Paul.
We'll wrap it up here. Thank you, everybody, for tuning in. Does anybody else have anything to throw out there before we kill the switch? No? Thank you, Sheila. Thank you, Thomas, Joann, Paul. John had to run, so we'll see you guys next week for the next episode of the Board Report.
Yeah, that's right.
Indian River Connections brings you the first source you can watch for truth on board decisions in Indian River County. The Board Report, where taxpayers and policymakers intersect. Be sure to subscribe on your favorite platform to get notified when we go live on Fridays at 7 p.m. Visit IndianRiverConnections.com for more. Sponsored by Gus Curran's House of Champions.